comments and bringing them in as needed. Please do mute yourselves when you're not speaking to reduce any background sound. Remember, the mute is the bottom left. So gray, you're unmuted. And if it's red, you're muted. So I'm going to go ahead and start the live stream. It's done. Okay, wonderful. And the recording. I think is also done. Starting recording now. And I'm going to start our transcript as well, which we're using for meeting notes. I'm forgetting where all of these things are. I'm sorry. Thanks for bearing with me. There you go. All right, wonderful. Thank you, everybody, for joining on this Tuesday evening. We appreciate you coming out. My name is Liz. I'm here with the Maryland Department of Aging. And on our agenda today, we're going to do a quick review of our aims, just to always kind of set the scene for what we're trying to do here in our third meeting of our Longevity Ready Maryland Stakeholder Advisory Group. Then we're going to work into reporting on our progress so far. So for those who do have objectives and strategies specified, we'll start to talk through those from the work groups, and otherwise really talking through the themes that are coming up and how our groups are moving forward. We want to, as always, spend some time within this group talking about the overlaps and the gaps and ways that we can ensure that these work groups are successful at developing some specific recommendations that can be included within the plan. And then we'll wrap up just kind of talking about next steps forward. This is our second to last meeting, halfway through here. So really thinking through that progress. So I want to just start by, thanking everybody for being part of this process. Our work groups have been extremely active, meeting as a group in our full group meetings, separating into breakout conversations to really have deep dives into the areas that we've asked you to discuss, and also working offline, including through shared documents and through conversations, to really work through this significant aim that we have here of preparing Marylanders to address the significant demographic change in our state of lower birth rates and longer lives. One of our chairs said today as we were preparing, we knew going into this that this was an ambitious project and with a very short timeline. And I thought, wow, that was putting it lightly. So we've been really, really inspired here at the Department of Aging by the conversations that the work groups are having and just all of the passion and knowledge that folks are bringing to the table. And so we're starting to really distill those conversations into a draft of the plan that speaks to why we're here. Aligning the things that the state is already doing to address equity and prevention and prepare Marylanders to live healthier, long lives. And then also really still looking at where we need to bring attention to the gaps in our system that are missing out on the opportunities that this demographic change is bringing. And as we're really drafting our plan, we're thinking through how to best bring all of the requirements that we at the Department of Aging have as a state unit on aging through the Older Americans Act. So I wanted to make sure that this group is aware of that too, that this plan is both our Longevity Ready Maryland plan and really specifies how we're going to be meeting our mandates for the Older Americans Act. And how that's really part of our longevity lens, really thinking about what a significant portion, an impactful portion of our lives takes place after the age of 60, which is what the Older Americans Act defines older adult as. And when the act was written way back in 1965, that wasn't really the reality, right? The life expectancy was 10 years less than it is now. The average onset of disability was 20 years earlier. So it really speaks to how far we've come as a society, but also the fact that we don't necessarily have services built for our healthy longevity lens that we really need to have in place nowadays to be prepared. So I want to remind everyone going into this meeting that this plan that we're working on together to develop is not a solution. It's the start of the work that needs to be done. And we're not solving all of Maryland's problems. We're really moving the needle towards the change that we want to see for the change that we're already seeing, right? So let's go ahead and get into it. We're going to move on to reporting on the objectives, strategies, and the work groups. I've got longevity ecosystems going first. And Pazit, that's you. Can I pass it over to you?
Thank you, Liz. I also want to recognize, and I sent that email to our group, that the MDOA staff had been extremely supportive, and everybody that we've come in contact with had been extremely forward-thinking and cooperative. And I just want to appreciate you all for putting this forward for us to do the work we have been engaged in. Our group had met and engaged in a lot of conversations. People have lots of opinions, ideas, suggestions, and we needed to narrow things down. And so we engaged in a process of voting because we can't do it all. And we settled on 4 subgroups. Each had been tasked with articulating one goal and then the strategies associated with that goal. There were some clear winners. Actually, it was heartening to see that even when you have lots of really wonderful goals, that the group coalesced around the top 4. And these are engaging grassroots hyperlocal models of community building. The second one is adopting the age-friendly communities models and practice. The third one is facilitating relationships between, facilitating relationship building and interaction between people across the lifespan. So looking at intergenerational, in terms of ecosystem, that's a big deal. And the fourth is supporting local government organizations and leaders through targeted resources and collaboratives. And they all revolve around expanding, enhancing, and improving the ecosystem. In terms of theme that had come up repeatedly, and I think that I heard a little bit resonated elsewhere, is recognizing that we need to first and foremost address this silo and fractured system that we have, that the state has a lot going for it, different departments, different resources, whether they're federal or state, in that we are faced with a system that's really broken down into bits and parts, and that there's not much to be gained by streamlining, connecting, developing an infrastructure that would make communication smoother, information flow better, and as a result, collaboration faster and more effective. And so I think I'm seeing that across the board. And there are some really interesting ideas around that. And I think I want to stop here. I don't want to take up. We are meeting, the subgroup are meeting, and they're developing their strategies and sort of wordsmithing each of their objectives. The next meeting is, the third one is the 24th of October. I hope we have a nicely written report, but I worry about the timeline, as I've mentioned to Liz before, that this is a very tall order to come up with a wonderfully worded, super thoughtful, all input provided by early November. So we will put forward whatever product we get to at that point, and, let MDOA take it from there, I guess. Thank you.
Great, thank you. And yeah, I just want to note that with the Longevity Ecosystems group, which I've been participating in as well, we're seeing a lot of overlap, of course, among our subgroups. And so we're seeing that probably each of the conversations might produce strategies within a shared objective that we're going to be, really trying to think through how to bring that together. And I think we'll probably find that through this discussion that we're having, a lot of those items kind of raised up across groups as well. So
one more thing I want to add, hold on, I just want to add, our ability to bring in subject matter expert had really made a difference, because although we represent a variety of opinions and expertise, once you drill down to a particular objective, you always question, do we have everybody we need around the table? So that had been, I want to thank Andrew for helping me, and also some of the group participants who have used their connections and brought incredible people to help us and contributed greatly to the depth of the conversation. So I just want to recognize that as well. And we will make sure that those folks are recognized at the final report. Even though they're not formal members, they've contributed greatly.
Thank you, Pazit. So next is the Promoting Economic Opportunity Work Group. Who's speaking on behalf of that group today?
I'm not sure if Miss Leslie's in the call, but I can just go over. Oh, you're here? Okay, go ahead.
I'm here. I can do it. So I'm going to be honest, I forgot which group I was in, Liz. So I was like, is that my group or not? Sorry about that, guys. So just like they talked about, we have had our 3 meetings. We have our 4th meeting next week. So we are moving along. Our 3 subgroups in promoting economics is family caregiver, because that's such a huge issue with paid leave and keeping our, our older Marylanders in the home, and certainly it responds back to economics. Is direct caregiver workforce, which I have in both. Teresa is my chair on that one. She's on the call and does fabulous. Direct workforce group, I have Cheney, and she's just wonderful too. So that's a subgroup. And then we have a 3rd subgroup, which is 50+ workforce, which also combines kind of multi-generational workforce, the challenges that older Marylanders have of sometimes getting bumped out of the workforce and needing to get back into the workforce and or grow within the workforce, those kind of things. So those are our 3 subcommittees. Every one of them have been having separate meetings and have come down to objectives. The wordsmithing is not quite there, so I'm going to kind of give just kind of overall arching themes of what each one kind of wants to go to. But within the family caregiving, the group is leaning towards an objective of having some sort of statewide adopted caregiving training program, which is also a collaboration of the care teams. This is something that actually is going on in other states. It's been adopted by a couple of other states. There's a much larger federal survey that went on. Sorry, that's my dogs. I'm one of the ones that Liz talked about. The dogs are really mad that I'm still working right now, so I apologize. So this was one that was kind of going to be supported federally also, which is the family caregiver being viewed as also a direct caregiver and collaborating those 2 together to give better outcomes. There's a lot of evidence-based of when the family caregiver is viewed and created and part of the care team of the interdisciplinary. So you got to get all of the, every medical professional to think that they're not just the person taking that person home, but they're part of the team, that there are, there's reductions in hospitalizations and falls and this and that and the other. So there's already some kind of some studies. So that's kind of an overarching. There are within other departments caregiver training programs. So one of the strategies is going to be really looking at Department of Health and Department of, even in Medicaid, there are caregiving training programs of kind of pulling together all of the trainings that we have. And could we potentially adopt a statewide resource training care team collaboration kind of approach? So the wordsmithing is still there, but that's kind of what they're doing. The direct care workforce group they're still kind of batting around which one is the biggest of the things, but they're also talking about kind of income and wages. You can't talk about direct caregivers unless you're talking about equity across the spectrum of income and wages. And even throughout certain counties, we have an inequity when it comes to kind of things like that. Kind of the workforce development, which comes from a lot of our educational systems. That's certainly, a part of what they're looking at, recruitment, and then a lot of data, resources and data to kind of really determine where are we and what we need to do. So they're still kind of batting around some of where they want to go on their objectives. Whatever objective doesn't make it in this first one, the others will go into our longevity ready plan because all of them are a factor of where we have to help support the direct care workforce. And then paid family leave, which of course has been passed, but is not funded. So how is the state going to get there? So I think that's going to get in there too. And then the third subgroup is 50+ workforce and multi-generational. And their main objective, well, there's plenty of them, but what they're really looking for is to come up with some sort of state certified older certification, again, wordsmith, don't hold me on the words, employer that you could potentially get credits for, but you could then get strategies on how to recruit, retain, promote, that kind of thing. There are certain counties that are doing this very robustly. There are other counties that are not. So there's an inequity across the state. And there are other states that are adopting, an older employer certification, which just means they've gone through the trainings. It's kind of like a diversity training. This would be in that kind of same vein. So that's what they're kind of working on. A lot of strategies amongst that one too. A lot of, again, the Department of Labor, and we probably have somebody here on the Department of Labor, has a lot of great programs already coming. Where can we don't need to probably develop anything, but where can we take those and make the state more equitable from the coast to the mountains? So that's kind of our three subgroups and kind of where each one of them are headed. They each have kind of where they're headed, wordsmith on the actual objective, but each one of them have already gotten several strategies. I don't think any of them have 8 necessarily, but that's what they're going to be working on. I think every subgroup has one more meeting, and then we have one more meeting next Tuesday, and then it's all going to be on paper, and then we're going to start writing. So we'll be able to present even more, but that's kind of our progress. So be happy to talk or answer any questions about promoting economics if anybody has one. And if not, it means I did my job really good. So there you go.
Well, I want to recognize one of the things that Leslie shared too is thinking about sort of that data and what we need to know. And I think that we've provided a starting point, and you guys are all bringing so much knowledge to the table. But we know that there's also going to continue to be some gaps, right? I've heard some amazing conversations from people who know all the literature and are still saying, but we don't know this. We really need to map this out. And I think that's the type of information that can and should end up in our strategies as well. How can we address what we don't know over this next 10-year period?
Yeah, I think, Liz, in that one, I think most all of the strategies probably across Longevity Maryland is going to be what else is already in development or has been developed and is in use in either a county or region of our state, and how can we build upon that? And that's just, again, building that equity across the state, which is what Longevity Ready Maryland is looking. It's a much bigger overview of the state. So.
Great. Let's go to our Affording Longevity group.
Hey, everybody. So we have the Affording Longevity group, and the goal is really about improving economic security and affordability for the 100-year, preparing for the 100-year lifespan. Our 4 priority areas are affordable healthcare, housing, financial security, and access to long-term services and support. And we're still making our way through the objectives, but we've had a lot of really robust conversation, and to try to get from try to form those objectives, we tried to form it as a question. So if that's our goal, then how do we change, affect, or impact those 4 priority areas to meet that goal? Like, that's how we're trying to get folks to focus on objectives, whereas the strategies are more so on the ground, and how do we, those are like the steps that we're going to take to meet the objectives, more like the action items or to-do lists. So in our last meeting, Izzy and I had taken a lot of notes and tried to pull out the themes of each one of the 4 subgroups, and then present some sample objectives to the groups and have them kind of noodle over them. Out of the affordable healthcare one, a lot of the themes were around, and I'm hearing it as a common theme across some of the other groups too, increased coordination. So increased coordination of like clinical and community connections, and then a focus on the social determinants of health. So we're still wordsmithing some of these things, but it was increased coordination of clinical community connections that address social determinants of health and provide upstream interventions to improve health over the lifespan. For the long-term support, services and supports. So it's really about increasing access, reducing the wait lists. And one of the objectives that they're tossing around was improving long-term, improving LTSS delivery to older adults by implementing a streamlined and comprehensive eligibility screening. And then, we're working on what the timeline for that might look like. How long would that take for us to realistically put it in place, and what else is sort of out there in the works already? Under the affordable housing subgroup, so there's a focus on a lot of different things. And so we tried to take the major themes and sort of compile it into one objective that is increasing state investment in a variety of aging-friendly housing options that are affordable, sustainable, and accessible through preservation, development, and adaptation, and improving housing stability by reducing involuntary displacements. So still working on exactly what the timeline would be and how to wordsmith that. And then finally, for our financial security subgroup, so really the common theme about that is all around education. And so increasing that financial literacy, but starting early. So, and running it through the lifespan, because ultimately we have folks now that are going to utilize some of these other things like affordable housing and, supportive services to meet their goals, because they're already in retirement, right? But also it's about educating the younger generations on how to be able to best afford and plan for that retirement. Oh, any questions or comments or thoughts? Great.
Wonderful, thank you. The last group is optimizing health, wellness, and mobility, and I heard a lot of that in the last group as well.
Yes, so my name is Mark Tesoro. I'm the lead for the Optimizing Health, Wellness, and Mobility. Dr. Rhea Kerbeck was called away for a client consult, an emergency client consult. So I'll be reporting for her. We have 4 subgroups as well. The subgroups for our objective or our goal are brain and physical health, person-centered care, transportation and mobility, and social connections and sense of purpose. And I'll just go through each just very briefly and give you an idea. Like the other groups, we don't have hard and fast objectives quite yet, but we do have very solid themes that are coming through, and we are currently in the process of really honing those themes down into really some solid recommendations. So for the brain and physical health subgroup, some of the themes that came across in our conversations with our experts were just a holistic system of care linking cognitive and behavioral health, addressing the social determinants of health, incentivizing provider participation, especially in healthcare deserts, in rural areas and such, strengthening the healthcare workforce, and increased use of lived experience and certified peer support. Some of the conversations, we have had a ton of conversations that are great strategies, but nothing that really quite is overarching, because it is such a gigantic subset. I think the closest we're getting right now, and what the group kind of is leaning towards, I would say would be the 5 M's of, what they're referred to as the geriatric 5 M's, which stand for the mobility for mind, medications, multi-complexity, and what matters most to me. So that seems to be kind of a very good framework for a recommendation, considering that it's so large and covers so many different areas that we're looking at, especially with the holistic concept and the multi-complexity portion of it, and the mind as well as the medication portion of what they're looking at. So a lot of the, for example, medication would be the polypharmacy issues and optimizing prescriptions. In the multi-complexity area, it would be the morbidity kind of issues that would be addressed in that. So those 5 M's seem to be where the group is headed for their recommendation. Regarding our second group, the person-centered care, some of the themes that came across were blue zones, coaching models, integrating very much like the previous subgroup, integrations of whole person-centered care, and just keeping older adults in the least restrictive environments. Maryland currently has a very strong Maryland person-centered planning guidelines. We're looking at that and how to either put some teeth to that or try to enforce those person-centered guidelines in the recommendation that we follow. We're not quite sure what that looks like quite yet, but that's what we're leaning towards on the second piece. For transportation and mobility, some of the themes that came across were transit-oriented development to improve access to healthcare, leveraging technology, ride-hailing, and potential self-driving cars, and those conversations, because we're looking, we're already almost there, and 10 years out, if we're looking 10 years out, that's going to be part of the landscape that we have to kind of get an idea of. We're talking about training transportation professionals of the needs of older adults, those taxi drivers, those Uber drivers, those Lyft drivers, to make sure that they have the training necessary potentially. In terms of draft recommendations, it really is a conversation right now has been around in how do we measure and report on improving health outcomes of seniors by transportation. So we are right now in the process of trying to really hone down some of these larger themes into something more narrow. And finally, social connections and sense of purpose. Those conversations, very much like the ecosystem and the other subgroups, tapping into neighborhoods and associations and villages, intergenerational kind of programs and digital literacy, just increasing support for middle income folks. There is, and I think where the group is headed for our recommendation is aligning with existing national strategies for social connections. So I'm not sure where that'll take us, but I think asking the state to align with the national strategy is where the recommendation may be headed for that last subgroup that we have. And I've been talking quite a bit, so I'll leave it at that.
Wonderful. Thank you so much. Does anyone have any questions or want to bring up additional points that you were seeing, areas of overlap, things that you think these groups should really be talking about, but maybe you're not hearing them in the presentations here? Go ahead, Sean.
Yeah, it sounds a lot of really good work and excellent ideas. There are some things that I just kind of think about if you asked, person on the street, what would they think they needed to stay in Maryland? Or if you talk to some of the advocates, what are some of the things that they would talk about that I didn't hear much of? And so I just want to throw those things out, things that occurred to me. And we could talk about whether there's any validity into looking at those since they didn't come up through the group process. But, you know, a lot of people say, I'm going to move to Delaware. A lot of people do move to Delaware because of the taxes being lower. And so in the context of affordability and longevity, I mean, we might want to look at that issue. How much is real? How much is, you know, I think it is real. I think people make rational financial decisions. So I think we could look at what's going on in Maryland. Is there some way to provide some tax reliefs to keep people here? Another issue I think is tech. Tech was mentioned in the context of showing people how to do ride sharing. But tech is something that is one of those cross-cutting issues that could play a part in all of these different aspects of longevity that I think we probably have to look at. We don't say anything about nursing homes or assisted living facilities. And, you know, as much as we want everyone to live very long and healthy lives, we know that some people aren't going to be able to stay in their homes and their families are not going to be able to meet their needs. And we've got serious problems in Maryland with the oversight of these facilities. So, and of course, what's happening with the financing and the ownership, private equity firms being opportunistic and finding ways to make money off of long-term care residents. So I think we have to acknowledge that somewhere. And as a former transportation person, I think the ideas that came out were excellent, but I think significant percentage of people are going to keep driving. And so issues around older driver safety, I really hope we can include somewhere in this plan. So those are some of the things that I was listening for, and then I just didn't hear them, so I wanted to mention them. Thank you.
Thank you. Let me go to our queue. Dan, you're next. Please go ahead.
All right. Thank you. Yeah, and thanks for all the reporting out. I really appreciate it. So I just wanted to kind of mention, I lead the Affordable Healthcare Work Group of the Prepare Marylanders to Afford Longevity effort. And thanks, Tiffany, for kind of sharing everything that kind of we're doing through that group. And just kind of listening to, you know, Mark's presentation, I think there's a lot of, I think it was you, Mark, but I think there's a lot of synergy really between the kind of the recommendations coming out of the Affordable Healthcare Work Group and the Brain and Physical Health Work Group of the, you know, the Optimizing Health, Wellness, and Mobility efforts. You know, we are we know that kind of, you know, unaddressed behavioral health problems kind of lead to kind of the overall high healthcare costs. You know, and so a lot of the efforts that you guys are sharing through the Brain and Physical Health Group about expanding access to affordable home and community-based behavioral health care and systems and prevention and earlier interventions, improving primary care, you know, the delivery of behavioral health and primary care. All of these things are things that are going to reduce the cost. That's echo the kind of things that we've been talking about, you know, that are going to reduce unnecessary reliance on hospitals and institutions, which is, you know, going to reduce the cost of healthcare overall. And so, you know, some of the other recommendations that we've been raising through that are expanding the use of technology to expand access to telehealth, you know, making sure that is parity compliant, and all of these things. I think, again, I just think there's a lot of synergy between our two groups, and so if there's any way we can kind of combine, I don't know what the next steps are for kind of coming out with these recommendations, but if there's any way we can kind of combine our recommendations to, you know, give them extra oomph, that I think it makes a lot of sense. So thank you.
Thank you. Agreed. Cheney, go ahead.
Hi, everyone. I apologize for not being on camera. I am with my children. But I wanted to just expand a bit because when the comment was made about engaging older adults, it triggered my memory that I'm helping co-lead under Leslie's leadership, the Care Workforce Group that is part of the Economic Growth Group. And one thing that I wanted to point out are trying to do and have been trying to do, because our group has been meeting for a little bit, is trying to engage direct care workers so that whatever we produce is reflective of what they, say is important. And so Meg Laporte, who is one of the other co-lead, has a relationship with the 1199 here in Maryland, and we're fielding a very brief survey that sort of tries to get to the touch points of what's important to direct care workers. I will also say, just to expand, our suggestions, our recommendations sort of fall into either income, wages, and recruitment and retention, or data capturing and building out a direct care registry for the state, which we have sort of been following other state examples, as well as, but we do have some specific language around how we might do this. I just know that it's in this large of a setting, it's hard to get into the nuances. But I did want to just lift up the point that there is some engaging of the workforce to ensure that their voices are incorporated in our recommendations as well.
Wonderful, thank you. Stephanie.
Yes, hi, thank you. And I appreciate all the reporting out, and I'm impressed with all the work that the groups are doing. I too was listening for a couple of things, and I think they're more cross-cutting issues. I don't necessarily speak to one group, but the first is volunteerism. So if I think about, I heard, purpose, I heard social connectedness, and I heard tax relief. And for me, volunteerism can touch all three of those things. And then the other one that I was listening for was nutrition, and particularly as it relates to optimizing health and wellness, brain and physical health. I think consideration for nutrition is really important. So those are the two things that the 2 points that I just wanted to make.
Thank you. Aziz.
I want to go back to Dan's comment, and I think that what I'm noticing is that there could be a situation where we have different goals under the different work groups, and then the strategies that we suggest will be very similar because it is the same. One strategy can then meet more than one goal. I don't know how we want to account for those, and I think that would probably some work for later processing, but there's no doubt in my mind. I already had kind of an offline conversation with a participant of another group, and she said, "Oh yeah, and I recommended this, that, and the other." It's like, "Oh, we're recommending the same thing as a strategy." So it will happen. In my mind, it actually elevates that particular strategy because we can then acknowledge the fact that it meets more than one goal, that it sort of has greater value than maybe something else. So that's my first comment, and something to think about. The second one is the challenge we're having for those of you who are not a part of the work group process itself and are maybe joining just the advisory group. We are faced with very limited expectation of how much recommendations for goals and objectives and strategies we're supposed to put forward. And we've had to go through a process of vetting, like, what did not make the cut. It didn't mean that we don't think these are important things. It just means that within the scope of this group work, this first iteration of Longevity Ready Maryland, my comment is that there will be some really important topics that we will not have touched on. And there has to be room in the plan itself to acknowledge, first and foremost, this is the beginning, the things we wanted to start working on. It doesn't mean that the rest is either not acknowledged or not important. We need to have some place to get our, start working on. And at the same time, if we as work groups have all done a little vetting and are missing really critical component that this group thinks is really important, how do we then integrate that back into the work group who have already begun their processes? So just trying to be in step. Like I heard Sean and Stephanie make some important comments. I can add a few that we have let drop. Do I want that to be dropped? I don't know. We need to recognize the limitations of this work group and figure out ways of calling out those areas that we're not even talking about.
Thank you. Other thoughts, questions? Go ahead, Sean.
Yeah, I think that that's an interesting point, and maybe to the question of, what is our unique role, as the stakeholder advisory group. I mean, maybe we have to say something like, okay, here was our basic template for what this plan was going to consist of, these 32 goals with the 8 times 8 different strategies, whatever. But maybe our role is to be looking at the forest and to be aware that, okay, there are some very important issues that are either related to multiple groups like tech, for example, or there are themes that, like communication and awareness of resources and things like that, that relate to all of them, and that we have to figure out some way of incorporating the cross-cutting, and that we by virtue of being in this advisory role, this group can feel empowered to do that, to suggest a slightly different, an additional thing. I think it would be very disempowering if we told a group, no, your 4 were not good choices, and so we're going to knock one of them. I don't think that would be wise, but there might be a way to expand a bit the framework. I guess that's what I'm saying.
Yeah. So Liz, I'll just kind of say, to Sean and Stephanie, I love the comments, and that is what we want. If you don't hear something that you think is important to what Maryland needs to do to prepare for longevity, then we need to hear it and make sure it's embedded. But the fact that you don't hear it doesn't mean it's not. But that's when we should be telling you. Sean, I'll just kind of go off of what you said on the housing and assisted living and the nursing home, only because that's my wheelhouse, even though that's not my group. Something we also want to make sure we're not doing in Longevity Ready Maryland is crossing over the efforts that are already out there. Because when you get 4 and 5 different agencies doing the same thing, we all get siloed and we don't go the right way. So, just the oversight of OHCQ it's tremendous. It's tremendous and it's huge. So there are a lot of groups and workforces and task groups that MDOA is on. And so a lot of our strategies are to continue to monitor commissions and workforces that are on that help our overarching goal for things like that. And so it's good when you say it, because we want to make sure that we're doing that. I could give you in caregiving, because that is within I just happen to know housing much better just because of my past. But within caregiving, there is a Maryland, a previous governor put forth and the current governor kept, a Maryland Commission on Caregiving. It's there. It's a very active group. It's working on family caregivers, not just for 50 plus, but for grandparents and this and that and the other. And one of our strategies, though that's in one of our strategies, is to stay very in touch with that commission and to let that commission do its work. 2 are better than 1. We don't want to override each other. So yeah, I like when we're hearing it. And I have to say, Stephanie, you mentioned nutrition. I got to think it's somewhere. I mean, I think it's probably a pretty big word within Longevity Ready Maryland. But I would say, don't anyone hesitate to say, I didn't hear that, because I know feverishly Liz was taking notes. I am too, that we want there. But we also want to let if there's someone making some strides in doing it, I think Longevity Ready Maryland's then strategy is to watch that, monitor it, support it, encourage it, push it, that kind of thing. But let them keep their potential work going, kind of thing. And I just know there's an awful lot of work going on in the housing with the nursing homes and the surveys, and I mean all of that kind of stuff. Good gracious, we talk about it a lot. So yes, so anyway, Stephanie, you raised your hand. I just thought I'd add that.
Yeah, no, I just wanted to say that the point that I was making with those two areas is that they are cross-cutting areas, that they cut across these different work groups and the different objectives. And I think that we should not assume that something is there. I think that we have to have intention. So I appreciate the I appreciate the consideration.
Yeah, absolutely.
And I think that's something that building on what Leslie's saying too, something that we need to get the expertise of this group on, and that we intend to get continued expertise and experience on as we move forward, because this is an ongoing process, is what are the, where is this work being done in other places? So for example, there's a whole task force on preventing and countering elder abuse that's going to be coming out with specific recommendations in December. So we have made the conscious decision within the longevity ecosystems group of not targeting in on that topic area, which is a hugely important piece of Longevity Ready Maryland that is being worked out somewhere else in far more detail than we could do in the amount of time and that we have right now. So that's just a hugely important piece. And then the other thing I would say is, we want to build up, lift up what's already going on. So I heard some really big points on the mobility about sort of pedestrian transportation. There is a really amazing series right now for Walktober, right, from the Department of Planning, really looking at a variety of facets of walkability, inclusive design, age-friendly spaces, incorporation of age-friendly spaces. For example, they have on coming up on October 31st, a sustainable growth webinar that has secretaries of different departments coming together to talk about creating spaces for all. So we know that there's a lot going on. We know about some of that. You guys know a lot about it too. Let's make sure we're bringing it to the table and highlighting it, and then really filling in the gaps that maybe we're not talking about quite as much as a state. I think that's where we want to think about the opportunity as well. Did I see any other comments, questions? Okay. Folks might be thinking, okay, now what? So this is our third meeting. We have 4 meetings of the Stakeholder Advisory Group officially within the term of building this plan. In the 4th meeting, it is November 12th, I think. Should be very solid on that. I think it's November 12th, which is a few days after our final work group meeting that is scheduled. So we anticipate that we actually will have a document in writing that we can share with this group ahead of time, that we can react to. We can build on the conversation we've already had about sort of where we're seeing overlaps and gaps, and maybe where we want to prioritize, thinking through maybe what's sort of a quick move versus something that we need a lot more information, and helping to build some strategies out of that. And then folks might have seen in our Reach Today, which is our Longevity Ready Maryland specific newsletter, that we're already planning for our town halls. And so we're looking in January to really present the goals and strategies that have been developed out of this plan, and to get some additional stakeholder engagement. See, is it meeting those needs? Is it highlighting where are the gaps that other people are agreeing we're missing that, or the opportunities that we're maybe not taking advantage of? And then, as we're doing that, we're building out the full plan, which will become live in July, and then the work really starts, right? So I think one of the things that, in addition to kind of confirming the final plans, I'm interested in this group's sort of suggestions on how we might want to continue our stakeholder engagement for the implementation stage, right? How are we building on this momentum and the networks and the partnerships that are being developed and being brought to the table here? So if anyone has sort of quick thoughts that we want to think about now, I think we have a few minutes to take some suggestions, and then we can kind of build into our plan a little bit further and give you guys a little bit more of the scope of that in the final meeting and get your recommendations. Any initial thoughts? We got nothing from YouTube. Okay. All right, good. Is there any additional resources, expertise, assessment that this group thinks I really need this for our groups to be successful in their final meetings?
Well, Liz, there was a report that we did with the direct care workforce, and I just happened upon it. It was from last spring. There's a PowerPoint that sort of describes it, and it included some focus groups with people who were providing care. So I was just wondering if I could share that. I didn't know who I should send that to if they were just interested in looking at Montgomery County's. Leslie's. Okay, Leslie.
Please
And me
send to me.
too.
I would love to. Thank you.
Oh, okay.
Yeah, and you send to me, I can get it, Cheney, I can get it to you.
Thank you.
Okay, and I think I have your contact list on the
Yeah,
drive.
I'd be on this email list, so I would love to have that. I mean, we have a lot of resources attached, but part of this whole thing is just wading through all of the other resources so that we're a much more comprehensive approach to it. We love it. Thank you.
Sure.
All right, wonderful. Any other last thoughts, questions while we're all here together? Anything you want to share that aligns, with this work that you think, oh, people should know this is out there and should join it? All right. Well, I think we can go ahead and close. We'll give you these 5 minutes back. Thank you so much for being with us this evening, and we'll look forward to getting your feedback in the final meeting. I'll send you all an email beforehand. Have a good night. Thank you.
Thank you.